look, there is so much misinformation about LASIK that, most of the people who wish that they were spectacle-free or contact lens-free don't get to what they could have had. Most of it is due to myths. And the myths, unfortunately, are, keep sticking because the volume of the people perpetrating the myths is louder than the volume from eye surgeons. I mean, we're busy doing our job day in and day out, and we have, busy practices, and we are getting people to see on a daily basis. And they're normal people. But out there, you have just a lot of bad information, It's not safe, we don't know about the long-term safety, you can't correct astigmatism, you have to wait until your prescription's stable. When you get older, you can't correct the reading vision. If you can only have it done once, if it doesn't work, if something goes wrong, you can't fix it. I mean, I can list 50 things that patients think, people think, and then which stops them from becoming patients. So obviously there's nothing to convince anybody about. I mean, nobody wants to wear glasses and contact lenses. Maybe they want to wear glasses because it's a fashion item, but nobody wants to be visually impaired. That's the point. And the fact is that we have a way of correcting vision now, which is hyper mature, hyper developed. It's 25 years and 55 million procedures down the road. And what people need to do, rather than speculate whether they should or shouldn't do it based on what their optician said or what their optometrist said or what some eye surgeon said, what they need to do is to go and get a consultation with an expert who does refractive surgery. Because by having a consultation, what you're doing is getting the actual facts. You're getting the facts about your own eyes. You're finding out if you are a candidate, because you might not be, in which case, you stop worrying about it. And once you have the facts, then you will find out what your risk profile is. And once people find this out, as sure as eggs are eggs, it becomes a no-brainer to have surgery. In the same way that people prefer the vision they get with contact lenses, because it's three-dimensional as opposed to just through a frame. So, and people don't think about the safety of contact lenses because, well, it's safe. Well, refractive surgery is as safe or safer than many types of contact lens. And the information out there is incongruous with the reality. So I don't try and convince anybody to have laser eye surgery. I just tell them, before you decide whether you want to or don't want to, go get a consultation with an expert so that you can actually make the decision in an informed way. So, in terms of, we don't try and convince people to have it. It's self-explanatory that people want to be rid of contact glasses and glasses. The step that I recommend people take during the process of deciding whether to do it or not is to get a consultation with an expert, because it's only that way that you can find out if you're a candidate, which 97% of people are, but you might not be. And then once you're a candidate, the particulars of your vision will then determine how the conversation goes as to what you could expect and what the results and what are the possible risks. Then you know the answer for yourself, and it's a very individual decision. And by and large, it's a bit of a no-brainer once you know what the safety is to take the step to actually have your vision corrected and stop having this disability of not being able to see without some kind of crutch. Well, LASIK for presbyopia is another one of these poorly understood concepts. The main reason why in the ophthalmic community LASIK for presbyopia is generally looked down upon is because of the history. Until recently, the only ways of doing laser for presbyopia on the cornea was to use multifocal optics. That's to put distance and near into the same cornea. And the same as intraocular lenses that are multifocal, this cuts down the quality of vision. It's not that safe. And so, unfortunately, when people say laser for presbyopia, they think we're referring to that. Modern laser for presbyopia has nothing to do with that. What we do in laser blended vision, or presbyon, for example, or it's also called modified monovision, although that's not a good term because it's not monovision. What we're doing is increasing the depth of field in the eye using continuous optics, nothing discontinuous. It's not a bifocal cornea. It's a cornea that has asphericity that's set up in a certain way, spherical aberration, so that the depth of field is increased in the eye. And it's done in a way that does not reduce contrast sensitivity or visual quality. And it's done using the time-tested 55 million procedures in the can procedure called LASIK. So you can have basically a 10-minute operation that heals in a few hours, and you're reading the menu without glasses, usually that night. It's certainly healed within a few weeks. Everything is starting to be very, very good. And it's an extremely low-risk procedure with an extremely high success rate. Not 100%, but extremely high. And certainly in comparison to what has come until now, which is to do what's called refractive lens exchange or clear lens replacement or permanent lens replacement, that is way higher risk, less accurate, has more side effects, and obviously is not reversible because once you take your natural lens out, that's it. And it's not adjustable. So, you know, the modern approach to presbyopia, and this is beginning now, and over the next 10 years, we're going to see this become the standard. I have no doubt about it. Is that we will be doing LASIK for anybody from the age of 18. You turn 18, you wear contact lenses from the age of 13 to 18 because you're responsible, you can use them. At 18, for your 18th birthday, you'll get LASIK on your way to university or whatever you're going to do. You might have another enhancement later in your late 20s, early 30s, just a little bit of correction. You'll get to your mid-40s, and then you will have laser blended vision or presbyon done in your cornea so that you don't need reading glasses. And then that might need adjusting a little bit more 5-10 years later. And then maybe 5-10 years after that, you might develop a cataract, or you might not. But if you do, no problem, because then you can have your lens replaced, a cataract taken out, something you can't see through, put a clear lens in with high quality optics, and the depth of field which is put in your cornea for the blended vision is now useful. And that's how vision correction is going to work in the future. That is the optimal solution. Currently, we have this idea that we're going to bring down the age at which we're replacing the lens inside the eye to 45, 50. And that is in my view, it's a very flawed argument, because in the presence of the ability to correct presbyopia without going inside the eye, it's definitely overkill to be replacing the lens in younger patients. Certainly, the safety is not there, and the long-term safety we can predict is not going to be as good. Going inside the eye changes an eye permanently. You know, macular degeneration can be accelerated by cataract surgery. Retinal detachment rates go up significantly the earlier you do the lens exchange. A 50-year-old has 20 times the chance of a retinal detachment after lens surgery than an 80-year-old. 20 times. So we're in this kind of transition period where cataract surgery became so much safer that the age at which we're willing to take the lens out went down. The multifocal lenses started coming into the market, but the realization that the degraded optics of multifocals is starting to hit home. And so this concept of early lens replacement with a multifocal lens, to me, is a wave that will go away. Because from a patient standpoint, they want the maximum safety. And I guess until we can say that an intraocular procedure is as safe as an extraocular procedure, there's just no debate. Safety is number one. That's my feeling.